Good morning, everyone. I'm Michelle Niehaus. I'm the Program Administrator for Deaf and Hard of Hearing Services with the Department for Behavioral Health, Developmental and Intellectual Disabilities. And we are excited to bring to you our second workshop with Makoto today. And this is brought to you with CORE, Kentucky Opioid Response Effort Funding. We want to look at the skills necessary to work with folks who are sign language users in substance use treatment and recovery. And before we got started, we got to know each other a little bit. And Makoto is going to take it over from here. I'm going to turn off my camera so that we have a better view of Makoto and our interpreter. We also have a second interpreter who will be joining us. One of the things that we have going on is that things happen, right? And one of the interpreters' laptop stopped working. So in flexibility and grace, she's actually driving to Heather's house and will be joining her at her home. So I know all of you kind of know about the creativity and flexibility it takes to serve people well. And we'll be talking about that throughout the series, because we know that we don't want one size fits all services. We adapt what we're doing to meet individual needs and the context of the situation we're working with. So yeah, I think go ahead, Vondre and Ron and Anthony, we'll all turn our cameras off and then we'll let Makoto take it away. Unless there's something else that you wanted us to do before we jumped in, Makoto.
Okay, I think we're ready. Hi, everyone. Thank you all for coming today. It's very busy and everybody's got a busy schedule, long week. Today's Friday, so happy Friday. And this morning I was like, am I on the right time with Eastern, or I don't know what time zone I'm in. So, but yes, I think I'm in the right time here. So I'm hoping that you all have your coffee or your tea or whatever you need to, enjoy this presentation and just sit here and relax. Michelle had already introduced some people. And so I think, we also talked about being calm, and, that's a really good reminder to just remember that life happens. And, like she had said before, like grace and flexibility. And I think that's a perfect match for today's topic as well. It's very important for all of us to have the different attributes as a professional, whether it's peer support or social work or anything like that. We need to be flexible and creative. So we'll discuss that a little bit more later on, but I agree with Michelle with starting the workshop off that way. So I think you all should have already got the PowerPoint. So I'm going to go ahead and, well, let me see. I think, are you guys okay with having like the PowerPoint side by side? I think, can you all still see the interpreter? That should be fine. If not, just let me know. So I'm going to pull up slide 2 here. So Michelle had already explained briefly the goals today. This is part 2. It's still considered basic learning and skills, but now we're on to the part 2. So it's working with deaf or hard of hearing individuals out in the community, different service needs, trying to support them and guide them to accomplish their goals. And so what skills are really needed for that? That's what we're going to talk about first. And then during the rest of the workshop, we will, there's always going to be barriers that come up and different things that we have to face when providing services. So it's important to remember those and think about that if it does come up in the future in your work, trying to break down those barriers. Third thing is when those barriers are there, how do we work on breaking those barriers down? What are some different strategies and different things we can discuss for that? And then slide number 3.
This is Michelle. Makoto, do you mind sharing the slide, sharing your screen so we can also see your slides? Yes.
Oh, yeah, me. Okay, I can do that. Yeah. Mhm. One second.
That's great. Now we can see it. If you can go to the slideshow. Yes, we can see the slideshow. If you can go to the top of your toolbar where it says slide and click, then you should be able to say start the slideshow, and then we'll only see the slide and not your screen.
Oh, okay.
Perfect. Thank you.
All right, so we good? Thank you for helping with all of that, Michelle. It's definitely more comfortable to be able to see both together. So I think I'm on slide 3. I'm trying to see, it's full screen, so I can't see the slide number, but I'm pretty sure it's 3. So this is a little bit of a review from the previous session. Thank you all for your feedback. I really appreciate that. Learning and trying to see what exactly you are hoping for to gain from this training. So I really appreciate that. Hopefully, I've included your feedback now. And then also, the same as before, after this session, please let me know as well. So with part 3, I can, make even more tweaks that I need to do so that everybody is on the same page. If you think about something that comes up and you want to share it, please just let me know. And you can feel free to leave a message in the chat if you want to, or if it's a small group, I don't know if we can like spotlight somebody quickly to, see their question. Any comments? I guess no. We'll go forward. Okay. I guess we'll go ahead, right? Keep going.
Yes, keep going.
Okay, got it. So I talked about the 3 learning goals that we're going to work on today, how to analyze and develop a treatment plan, and encourage the clients to have support to achieve their goals. So we use many different tools to try to analyze things. Even though, there's addiction and recovery that has many, subgroups to it. And so some are, short and some are very, very, very in depth. So it just kind of depends on which one we're discussing. So for this training, I really am going to try to use one. This is from my old job in the recovery program that I previously worked at. I worked there for 6 years until February. I resigned from there and I'm working in a different position. So the tool name is GPRA. It's over there on that slide if you want to look at that. Government. One second. Hey, Michelle. Can you hear me, Michelle?
Yes.
Okay.
This is Michelle.
So
We
to
call-
make sure we can see the speaker, I can't see anybody else. I made him really big on our screen and then his screen is small. So just letting you know if anybody has comments or anything, I can't see anyone except for the presenter. And
Okay.
so I'm trying to navigate so I can see his slide at the same time. And also Alicia, the other interpreter, is here. So we'll switch eventually. Okay. Just letting
Okay.
you know.
And just to let you know, the way in
Alrighty.
Kentucky, we say that it's the GIPRA,
GIPRA.
GIPRA, GPRA. Mhm.
Okay, got it. Thank you. He said, I don't know how to pronounce these things, but thank you for saying that. Yes. Okay, so the GIPRA, it itself has a lot of material and a lot of information, a lot of questions. And normally I notice with the hearing therapists and also case managers who use the GIPRA with their hearing clients, I notice that it's like less than an hour typically. They can just stare at the screen and the client can respond, and they can hear that and it goes a little bit quicker. There's lots of questions and lots of information to get. So it's very specific. And, when I'm having to look at it and see the English, then I have to switch that over to ASL. And then I have to look at my client and ask the question. And then my client has to look back at me and answer in ASL. And then I have to look back at the computer. So it's a really long process, you can imagine. So for other people who speak other languages, that might be, similar to ASL, but I'll show you some of the questions from the GIPRA and so you all can get a better idea of what it looks like. We're gonna have to get a better system.
Okay, I think I've got it. Okay, the interpreter ready? Yeah. Okay, so moving on to this slide, I pulled 7 examples from the GIPRA. These are just the assessment questions from that tool. I'm not going to elaborate on all of them. I just put them here for you all to glance over and skim yourselves. So here's the first question where it says, have you experienced any significant? So, really important life improvements since entering treatment. And I've noticed sometimes with my deaf clients, finger spelling is required for some of those words, like the word significant. And just to kind of go back to, English is not my first language. And there's not an exact one for word translation for some of these words into ASL. And, some deaf folks, do rely on lip reading. And so we could use that, way to emphasize the word significant, but it's really important to make sure that you've got, a clear way that you're expressing this to your client. So back to that word significant, sometimes we can finger spell the word significant and then use this sign right here, which translates to like important. And that's more of a common word I think folks are familiar with. But does the sign for important capture the context of significant? Because you can finger spell it and throw that word out there, in English, but the deaf client may not understand or have context to really fully grasp what you're trying to ask. And that's where we as providers have to take a step back and consider, like Michelle had mentioned previously when we had started, that flexibility is crucial. We've got to get creative. And we got to utilize those problem-solving skills and how we approach this. And if you have any ideas that come to mind of other options that you think may work here, please utilize the chat to throw those in, because we do have to get creative. I mean, we've got 9 folks on, so we have 9 wonderful brains here to give us some ideas. That's the reason it's best if we work as a team of therapists versus one therapist alone, is to have that support. And that way too, we can better accommodate our deaf and hard of hearing clients. So even just something as simple as some of these words can be so vague or abstract. And it can be hard to convey that concept in a way that deaf clients can understand. And it's hard too for us clinicians, right? To figure out, how we as professionals ask this to make sure we're getting the right information. And that's the reason that we need to learn these different skills and different approaches to make sure that we are assessing correctly. So, this is just one example. Can you imagine all of the examples we could find in the rest of these? And there's not one perfect solution. And it's simpler when you do have, a client whose native language is English, because, as a provider, I could just read straight from the screen and hopefully, that would be enough. But then when you add this part of translation into it or interpretation, it can get a little dicier. You may have a client that doesn't understand the word in English and they may ask, and you can elaborate fairly easily. But when it comes to interpreting into an entirely different language, my gosh, that process can be quite lengthy. Next slide, please. So this slide just speaks to the variations that you see among ASL users. And this kind of references back to some of that information we used in the part 1 of this training. Because it's not just, English to ASL. Because there's not one blanket way to use ASL. You have some folks that could take, English and then put it into that ASL signing system, but with an English grammar, and they may understand it. But, ASL itself, the language, has an entirely different grammatical structure, entirely different syntax. Like in some languages, you do subject, verb, adjective, but in ASL, yeah, there's a whole different system in order for that. And speaking of ASL itself, it is not a universal language. There's not just one way to use it. There's all kinds of variation. I mean, it could be different, depending on like regional dialects, where those consumers are coming from. Because, you all are located in Kentucky and I'm down in Atlanta. And then, you could compare the language to DC and then all the way to California. The way that you're going to see that language used is going to vary depending on the region. It's the same way when we talk about English. You can hear when someone may not be from a similar area, you can hear a little difference in the accent or the way they use certain words. It's the same concept in ASL. And then kind of going back to age and then exposure to language. And it's similar to, folks who use English as a first language. You've got differences, in the linguistics between like younger generations versus older. Sometimes the older generations hear, younger folks speak, and whether it's regards to like technology or a movie or whatever, but something that those younger generations are more interested in compared to, our older folks, who are going to reference movies from a long time ago or use, different words that the younger folks may not understand. It just goes back to, those differences in language use between generations. And while we're on the topic, the idea of exposure to language. Where did you initially learn your sign language from? Who was the person that taught you? Did you grow up with deaf parents? Was it peers? Did the only exposure you get to sign language, was it online? Some folks even learn sign language from their interpreters, especially, our deaf clients that grew up in like a mainstream setting in a public school system. And some folks, start learning sign language from infancy. And quite frankly, those are the fortunate ones. And then you have some folks who don't get exposure until, way late in life. And so, they're kind of playing catch up on that language use. So the way that they communicate is going to look different. So yeah, there's all kinds of things that can impact the way that you see sign language, even educational background. Did you have someone, who went to college? Did you have someone, who went to like a different kind of educational system? I mean, that's going to impact language use too. And so that the supports that they're going to need are going to look different. So down to number 4, talking about cultural affiliation. Is this person involved in various organizations? Are they pretty isolated? You've got like, smaller D deaf folks and then capital D deaf folks. And so that's going to impact that language use too, whether or not you consider yourself culturally deaf. Some people experience their deafness as something to be proud of, and they take pride in that deaf identity. And then other folks who are not culturally deaf may feel differently about that deafness in their language use. They could even have other identities that are going to be at play and intersect with their deaf identity. And you will see that in the language. You may have, a client who is fluent in sign language and is going to feel more confident in expressing themselves, and then with that deaf identity as well, as compared to another client that may be a bit more reserved. They may not be as expressive in their communication. And you can typically tell, how much, I guess, involvement we'll say within the deaf community based even on just what you see in communication alone. And then number 5, we talk about bilingualism and then code switching. And this is definitely an important skill to have, not just with the deaf community, but just folks who come from different cultural and linguistic backgrounds. Because of course, those cultural and linguistic backgrounds are going to come with different values, different biases. And we got to make sure that the way that, we meet these clients, we meet them halfway, and we meet them where they're at. And that goes back to, like we've referenced before, that flexibility piece. because, we ourselves can also, kind of code switch, meet that client where they're at. And then that helps to, create a smoother interaction. But yeah, you have folks that, if they do have both languages, they're really good at switching between the two to kind of mitigate what's ever happening in the environment. I mean, we could go on from there. I mean, technology alone, oh my gosh, we have new technology every day. And you have some folks who are more tech savvy and, stay up to date and current with the trends, and other people who are a bit more out of the loop. So again, I mean, all of these aspects can impact language use, and you're going to see, oh my gosh, so much variation. Like Michelle's mentioned before, one size never fits all. Okay, next slide. Okay, yeah, and please feel free to add to the chat. I'm trying not to look at the chat too much. But, we just talked about technology in the past slide. So going back to, again, the tools that we can use in a creative and flexible ways to make sure that we are able to meet that client where they are, and so we can work cohesively together. One moment, we're going to switch interpreters.
Okay, we're back. So what skills do we need to have to work on the screening and the assessing and all of that for the different treatment plans? And all the way from that until discharge, it spans through the whole treatment with the client. So of course, sign language proficiency. And like I had commented before about how English has different levels, like you have like first grade on the way up. We also have ASL that has their own structure and grammar and the way that it's signed and used. So it's not going to be standard for everybody. In America, there's any place that works with deaf or hard of hearing people, of course, is required to provide an ASL interpreter, and that interpreter needs to be proficient in sign language. So there's a few popular ASL skills when it comes to analyzing, and also you have to get certain scores and prove that to the different companies where you work that there is a certain level of ASL proficiency. And then that way you can show that you're able to go ahead and do these different tasks with deaf clients. So people who have this sign language proficiency do not, there's obviously not going to be a lot of people out there that have that capability to sign themselves directly with a client instead of having an interpreter present. So oftentimes the best way to communicate is to provide the interpreter. The second one is cultural competency. So there's going to be lots of different cultural variations. I think we had mentioned that during part 1, if I remember right. So we'll go on to number 3, which is communication skills. That's a very important thing to have. It's important, and I try to emphasize this because with deaf staff members, at my previous job where I worked with the deaf team in Atlanta, Georgia at the addiction treatment program. I worked with hearing folks as well. There were hearing members as well there. But I learned a lot about language skills and communication skills, and those are different. So I'm not sure if you all have had any experience with traveling outside of the United States, where there's a different language that's primarily used than English. So you still can communicate, you can find a way to kind of muddle through it and figure out what you're doing, regardless of the language. And some hearing people are really skilled with coming up to me, and even though they can't sign, we find a way to communicate. And it works out well. It's obviously there's going to be the simple paper and pen method, there's going to be gesturing, there's going to be pointing. There's showing something on the phone, using the phone as a way. So there's obviously various different ways you can interact with people, that could be considered communication skills. So I've seen some people that sign really well in ASL, they still can't communicate very well. So again, I just want to make sure that there's a difference between, the communication skills and the sign language proficiency. And then it goes back to being flexible again. And then also, like I mentioned, the GIPRA, that test, previous before about the different ways to assess. So number 4 is the assessment adaptation. So, like if you see these questions on the screen and you're reading them, then you have to kind of change and code switch to make sure that you're matching the language that the client needs and can understand. Oftentimes they might give you some feedback or they might not, but you need to make sure, obviously, too, if there's an interpreter there, then that should go pretty well most of the time. But, maybe the interpreter doesn't, interpret that correctly, or maybe they're a new interpreter and this is a really tough type of, situation and language. So just make sure, for the hearing consumers, that they need to make sure they can ask and get the information down right. And if it's not working, then try a different way. I know that sometimes you feel the strain of the time constraints that are put on you, in regards to meeting with the different clients, but it's just important to double check and make sure that you're, matching what needs to be done for the client. So there's other, assessments, that I can show you as well. So now number 5 is diagnostic competence. And you've all had lots of practice and experience with that, but the cultural competence can also play a role in that. For example, if you have a deaf person that's just, signing away, and sometimes hearing clients or hearing clinicians will, like see that as like maybe they're having some type of delusion, or maybe even like a hallucination, or maybe they think that they're angry or aggressive just by the way that they're signing and coming across. But a deaf person can look at that and say that no, that's not a problem. Maybe they're just proud to be deaf, and maybe that's their normal way of communicating. And like I mentioned, there's an ASL variation, so some people will sign a certain way and some people will sign a different way. So it's important to make sure that you're aware of what that's coming across as, and it's not always going to be what you might think. So it's really important to have the training to make sure you're analyzing your client correctly. And then also with the cultural competency, knowing that there's some differences in the culture, you need to see, is it regarding the culture, or is it something else going on? So like I mentioned, there's different layers to these different skills. And number 7 is very, very important always, with the collaboration and advocacy, the team approach. Like I said recently, one brain is fairly limited, right? But if you have a team of 4 or 5 individuals, then you're going to get some different perspectives and try to make sure you get the right intervention and the right treatment plan for the client. Is that clear so far? I hope so. Okay, next slide. So when working with deaf clients, there's obviously signing and communicating in their language is important. So it's important to know how to work with deaf clients who use ASL. That's our focus. Um, it's ideal, the goal is, that we can sign ASL ourselves and have the fluency to be able to communicate. And obviously some people are not going to be sign language users that are here on this training today, but there is lots of options for you all to even get some very basic sign language classes. They have lots of different things that you could find as far as just taking some, basic sign language classes. And so then that way, if you do see somebody who can sign and uses sign language, saying something simple like good morning or hello, like that really makes the deaf community, the deaf user, very happy because they feel more involved, that you're taking the effort to show them that you're doing a few of their language, and communicating with them together. And so I think there's some different places we've talked about before that can do sign language classes, but that would be a good option if possible. But then we've also talked about that you can use an interpreter too, right? And so the interpreter is going to try their best to, match the client and what they need. But for some people, there's just not like a clear understanding going on. There might be some visual aids that need to be used. Those can be very helpful. So for example, I put a few different things there on the PowerPoint slide. You can just use the computer and just type in Google and do a quick search and pull up a picture of what you're trying to explain, tilt the screen over and show them what you're referring to. Sometimes the computer has some different blocks as far as like privacy and things, and you have to work around that. But it's important to, take off the confidential information, or maybe you can just use like an iPad. That would be just a visual aid tool as a separate from your computer. And if you have like a weekly treatment meeting, and this is going to be, very frequent, then maybe go ahead and print something out and have a picture printed out and ready. So I want to show you an example of a previous thing from my old job, like this. This slide right here shows you the 3 different pictures you can see. So the first one is saying, I'm feeling, and then we have all the different emojis that show the different feelings. And there's also English words underneath there. So some deaf clients, rely on that and they want to know what the word means, and then I'll explain it. But you see the other over here on, like, it looks like a stages of change in the circle there, and it shows different parts of that. So I looked for that stage of change for a while so that I could apply it to recovery, but there's not one that's really specific for that. But this one does show you the different things in the different stages. And then it talks about like eating better, I think was the main thing about this. The only one that I could find talking about, trying to have a healthier diet and the different eating. So I think it's very clear. And I do actually use this picture quite often to show some of the deaf people, not during the actual assessment, but like in the treatment plan meeting. And I don't know if they know the words, like it says contemplation. That's a pretty big word. And to me, I'm like, what are they talking about? So that might be a little bit hard to explain. But then that picture shows you very clearly that that person is sitting there thinking, like the thinking bubble right there above their head. So that shows you very clearly what's going on in matching that word. So this is a tool that can be used. And then in the morning, we would have a program. And so sometimes, like Michelle had mentioned before, life just happens, right? And things do not always go as planned. So it's nice, to just be prepared and have some like printouts like this and then show them, like the stages of change or how you're feeling or these different little smiley faces at the bottom. You got to be creative and be ready. So you can ask your clients, like, how mad are you on this scale, and then let them point to it. And then you can understand a little bit better. So I think that's a pretty good example. Next slide.
Do you have any questions thus far? Is everyone following along okay? Trying to make sure that I take it at a pace that's comfortable.
This is Michelle Makoto. This is fantastic. The visuals are really good. And I love how you're connecting the need to communicate effectively and make sure you're matching a person's language. So thank you so much for adding all the visuals.
No problem. Okay. Okay. Well, so here on this next slide, actually, I wish that I had moved these around a bit. So yeah, this is a newer slide with a few different images that I hadn't used previously. The reason I wish that I had like swapped them around is because like when a deaf client initially comes into treatment, we're in the assessment stage. And then just referencing back to the GIPRA, all the questions that it entails. I'm trying to think, I don't remember if there were any questions concerning drugs and alcohol use. Forgive me, I can't remember if it does include that for sure. Because my gosh, like I said, it's a really dense assessment. So there may be a section about, drugs and alcohol use in particular. I wish that I had actually included that today, but that can be another challenging topic, and a barrier to treatment for a lot of folks that I think that, you'll encounter. I mean, and like I said, deaf folks in ASL, it's a spectrum, it's a continuum, and you're going to find people all along it. You may have somebody who is from, another state who's not from Kentucky, but then, just happened to move, last year. So you're going to, yeah, but my point is, oftentimes clinicians will say, how many or, what amounts of alcohol do you consume? Like how much drugs do you use? Like that kind of, questioning. Like, then it gets down to like, are we talking ounces or milliliters? Are we talking cans, bottles, what have you? A case? Or is it metal cans? Is it bottles? You're going to have, different, amounts in each one. So, I mean, like you're going to have it sold in different quantities. And so again, kind of using this image to be able to, accurately figure out how much this person is consuming. Maybe they said, I drank 5. And so, okay, you drank 5, what? 5 cans or 5, like a fifth? And what is it that you're drinking? Is this wine or is this beer or, so yeah, using an image like this to be able to just explicitly show, because you can see like you've got a glass of white, a glass of red, then you've got the bottle or even boxed. And boxes are going to come in different quantities and sizes as well. So being able to, you may have to like actually kind of gesture and figure out, trying to get a more accurate idea. And you may have somebody who doesn't want to be truly forthcoming. So, and that kind of goes back to that body language and kind of, reading the whole picture and just using this, you may be able to get a more accurate idea of how much they're consuming. So even just bringing like, a picture like this, printing it out, bringing it, I think there's going to be less confusion and hopefully clearer communication. And when it comes to drugs and alcohol, looking at the top right image here on the screen, I mean, the purpose of this image is to kind of give the client an idea of, what that could even entail. Drugs and alcohol, it's 2 words, but my gosh, like categorically, there's all kinds of different options within that. So using something like this that may allow the client to, recall more accurately what they've used in their history. And it may actually be a bit more motivating for the client to share, like, oh, I have seen this and this, the cigarette, like, have you used this before? So being able to kind of pull and tease out that information. And like I've mentioned, having these resources already ready to go before your client comes in, because you're not always going to know like what's happened. Perhaps that client recently had a relapse. Or maybe even bringing in something, that's talking about coping skills to figure out, what do we need to do today? Because sometimes, somebody doesn't have that signed communication. But, having that picture may continue to elicit some further like thoughts and, mulling that over. So hopefully using these pictures can kind of help that person to recall more accurately, like, what they've experienced. And to kind of, even think about, oh my gosh, if I were to use these substances again, what could happen? And then hopefully that opens the gate to talk about some healthier coping skills and even talking about, what are the consequences and outcomes of employing those coping skills, but using these as a reminder of what the outcome can be after their decision making and the choices that they make. Oh, do you have a question? I can't see. One moment. Hold on, please. Okay, Ron. Oh. Hold on, 1 second, please. Okay. This is Ron. I wanted to speak to an experience that I had with a deaf person, a client. Communication was very different, I'll say. Like their communication style was rather different than what I had experienced. I want to say that they were on a lesser fluency side of the spectrum, had a lot of struggles throughout their life. And he was living with his mother and had done so for many years. There was like a legal guardianship or some kind of situation that had him within his mother's care. And he was desiring to be more independent, but mom was not ready to let go of that control. I mean, the client was around 50 or so, but the mom did not want to relinquish that power that they had, and was actually holding on to his SSDI income. So it was really challenging. And I was just curious, have you had any experiences like that? And Makoto is saying, yes, we unfortunately do see tons of folks who are still living with family, and not necessarily just because of a lack of life skills. And I want to make it clear, I am not against folks who are still living with family. Because, in some cultures that family, bond and staying close is crucial. And, and sometimes too, maybe family members do need that extra help. But having those financial boundaries within that family system is pretty big. And yeah, unfortunately, sometimes parents are overstepping and using benefits that their kids receive. And, you know, oof, I have to admit, like that's rough. And, you know, I think part of it too is kind of getting to know that family and understanding what's at play, you know, within that particular system. And Ron is saying, you know, it's a bit frustrating, but it did seem like the family was overstepping and really holding that individual back. And it was, you know, frustrating because I felt that I wasn't able to fully help that person because of those constraints. And then another thing that I wanted to mention is about the big book, you know, the 12-step program.
Some people don't want to read big
Some people
books.
don't want to read the big book just because of, you know, those religious undertones or overtones and, you know, God being at play. So I'm curious, have you found another 12-step program or text that doesn't have those religious threads throughout it? And Makoto is saying, you know, when I was still working with the Atlanta residential program, you know, there were different 12-step programs there. And yeah, we utilized the big book. And yes, there's, you know, a lot of like Christian themes throughout. And, you know, every morning, we would, you know, there's like the serenity prayer, you know, God grant me the serenity. Yeah, there were some, you know, many, I would say, honestly, folks who did not feel comfortable using that kind of language and, you know, using that frozen text. And that's what I was trying to explain. You know, God doesn't have to be God in the sense that, you know, we typically understand that. And, you know, and it's hard because that text is frozen. So, you know, there's not much flexibility within it, but kind of explaining the concept of who is God to you. Is God a higher power? You know, and using that kind of language, you know, what is your higher power? What does that concept mean to you? You know, some folks may consider that God, but others may not. You know, it may be more higher powers found in nature. But where do you find that sense of peace? That's what we've done. And yeah, but that's a great question. Thank you for asking. Is there anything else? Any other questions? Okay. And again, my gosh, thank you for asking that. Oh, I'm so sorry. Hold on. Yeah, thank you for navigating that. I'm sure it's a lot. But going back to what I was saying a moment ago, yes, great question. And we're going to have more of those, you know, in our work. And you may have, you know, a deaf client in clinic that, you know, comes in with this same concern. And, you know, and like we were just discussing, there's really no like cookie cutter answer. It goes back to being flexible, keeping an open mind, and thinking outside the box. You know, there may be a person that, you know, just has too much, you know, with that word God. And so having to find a different way. You know, and some folks, you know, they may say God a bit begrudgingly, but again, clients are going to come in all shapes and sizes and beliefs. And some people may have, you know, no problem with using that concept, especially if they grew up in the church. You know, and a lot of times I will say, you know, when folks do go to church, they may not even have an interpreter there. So church can be a bit of a traumatizing experience depending on that person's background. Because, you know, if they were the only deaf person in that church, then, you know, that they may have experienced a lack of communication and they may have no issue with God, but that idea of how to navigate that on a personal level, and having that personal connection with a higher power or God, yeah, it can, yeah, it can be different. So kind of going back to the slide and with the picture here on the bottom. You know, alcohol, I mean, my gosh, it's easily to consume, you know, you grab the liquid and you throw it down the hatch. And then, but with different drugs, there's all kinds of different modalities, be that injectable, you know, nasal access. There's all kinds of different ways, but, you know, there's not exactly one way to sign that in sign language. So it's going to come back to that, you know, that more gestural acting out, showing, or even using the pictures to elicit more information. And here on the screen, there's like the four pictures. There's like 4 different ways to use drugs. That's what it's showing here. But honestly, I will say, you know, from my experience with clients, whew, they can be pretty creative in finding all kinds of different ways to use, you know, whatever substance, you know, gosh, yeah, the tools are limitless. And I mean, some of the tools can be expensive, you know, the things that they would need to use in more of the traditional way. So, I mean, folks will find whatever they can, be on the street, in the prison system, they will find a way. So using this, I mean, it's a good visual aid, it's a good beginner tool, but it is not all encompassing.
So with the next slide, I've been trying to find some different pictures that I think would match well and help us to understand with what kind of visual aids we're looking for to make sure we have the right ones. So you can see the pictures here. I guess it would be on the left. There's 4 different cups or glasses with beer in different amounts. And it's relating the liver. The liver organ is on the top of those pictures. So if you drink too much, it's like a really, really dark red. And your liver function goes down. So it's kind of more like, you know, with the treatment, you know, you have the psychology education, and some people don't believe it. They think beer's fine. Beer's like water, it's nothing. And I'm like, no, you know, over a long period of time, if you drink that every day, your liver will start to look different, you know, and it'll impact you. It can lead to vision problems, walking problems, breathing problems. You know, there's many different things it can do. And so it's really important to keep care of yourself and your physical body. So that kind of picture can kind of just help you all to visualize it, you know, and I don't know, it's just something. Again, you know, different clinics need different attributes, and you know, the biggest one is patience, right? So there's those pictures.
Puede que te puedan ayudar.
Okay, the time is not really lining up here to my slides. Hold on. So the next slide is discussing the different barriers and different screening assessments. So if your ASL is not matching the client's ASL, or the interpreter isn't available, if there's some type of emergency like a detox program, somebody shows up and they need an interpreter right away, and maybe they're on the way, there's going to be some communication barriers happening in those moments. You know, that visual picture I just showed you, you know, you can use something like that to communicate basic information. writing down with, pen and paper. So there might be some more, in-depth assessments that needs to be done, but that would be ideal to wait till the interpreter gets there. Maybe they need to use the restroom, maybe they need to eat something or drink some water. Those kind of gestures could be done pretty simply. Some type of other mode of communication to interact with that deaf client until an interpreter can get there. It's really important to engage and, make sure that they feel included and appreciated in that moment. Like basic ASL signs that you all might know is ask them, how are you? What do you need? Some very brief sentences in ASL that you all could learn from a basic ASL class. And that would be a big benefit to you all if you ever would have a deaf client come into your office, and they would feel more accepted, and if you had a way to communicate with them until the interpreter arrives. Like the pre-treatment, I guess you could call it. That those few moments are important in that first, phase. When the client comes in, you want to give a positive impression on yourself and the office and make sure that that client feels comfortable and safe. So some of the other communication barriers that we've talked about there, we could also mention like the limited resources, the literacy disparities, meaning that there's not enough information out there for the deaf community. There's stigma and discrimination, and also access to care. So I think you all kind of understand those terms pretty easily, can envision what that is including. Is there anybody else that might have a question? Okay, so I think we're good. We'll go ahead and move on to the next slide, and then try to have some discussion on what we've already talked about and the different resources, and trying to navigate through all this. So we have had, a question already of something that popped up in your all's mind. And so if there is any big things that I want you to take away, it's important to just let the client know that there is an interpreter on the way. So a way to do that is to get started by making sure you have a contact for an interpreting agency or an interpreter that you contract with, to make sure that you have services ready should a deaf patient come in at any time. Some people use ASL, but they also rely on reading captions or subtitles. So any kind of written English material, like what you're seeing now on the screen, there's captioning as well. That might be on there because some people requested it, but obviously that might not be available at all times. But in like a recovery class, like a group therapy, some deaf people do request to have a captioning service. From my old job, I remember like they would sign and hang out with all the other deaf people, but then to actually understand the signs, they wanted to see the English with it. And so everybody's experiences are going to be a little bit different. And so outside of the classroom, some people want to just, sign, but then sometimes in like a classroom setting, they might not understand all the information that way. And so there was a deaf client that had asked me to set up the captioning. Luckily, Zoom has the captionings on here. Excuse me, and they're, I would say maybe 90% right, not always, but it's still enough access that they can read the information and see that. So if somebody requests the captioning, then please definitely try to figure out how to get that service to them, whether it's Zoom or something else. And maybe your program treatment center might have a TV. Make sure obviously the captioning is on there. You don't want a deaf person coming into the waiting room and sitting there with no captions on the TV. So also the visual aids that I just talked about, you can search on something for Google and find something creative that you want to put into your lobby as well. So accessibility, accessible technology. Just make sure that you have a video phone. Then that way, if a deaf consumer comes in and wants to make, excuse me, a phone call, they can go ahead and get on that video phone quickly and make that phone call that they need to make. Because a lot of deaf clients might not have the accessibility to have a video phone at their home. So it would be good to have one in the office. It's also important to try to keep our awareness more fresh and stay up to date on different things. Also, the collaboration with deaf community organizations is very important, to come up with strategies or different ideas for the deaf treatment programs that you have and the different services. Like Michelle and her department, they get a lot of feedback to make sure that the treatments are on an individual level or an agency level all together, to make sure that they're inclusive and comprehensive. Okay, thank you, Ron. Oh, yeah, feedback. LRCC needs to set up a video phone, is what Ron commented. Oh, perfect. Okay. If there's any other feedback here.
Sure, Makoto, just to let you know, and the folks on the call know, anyone who has a core funding, Kentucky Opioid Response Effort funding through our department is required to have a video phone on site and is eligible for reimbursement for any interpreting costs or captioning or purchasing assistive listening devices or amplification for their programs. And you can reach out to me and to Anthony for any questions you may have about how to do that. And David Brummett, BRUMETT, is also going to be reaching out to folks in the next few weeks to check on status for those things.
Great, that sounds good. So I'm going to pull up my last slide here, which is a little bit of a review and creative thinking plan. So, you've been watching and listening to the presentation thus far. So I wanted to bring up some different questions here to kind of review. Do you remember the second slide I had showed you the 3 different learning objectives? Do you all remember that? So then now if we can go back, that's the same question. Excuse me. That we're referring to. So learning to work with deaf and hard of hearing people who use ASL. I just kind of want to talk about like what you've learned today, and hopefully you could feel comfortable using different skills going forward. So that's kind of what I would like to discuss first of all. It'd be great if you wanna, type in the chat, or you want to use the interpreter to say your. We have just a couple minutes left here.
This is Michelle. Why don't we have you stop the share on your computer? And then we can have everyone join by camera, and that way we can have a little bit more discussion.
Okay, perfect. Sounds great. Good idea.
So we invite everyone to turn on their cameras. And Bondre's first, good job. And Dylan, you got here late, and Daniel claimed that he's the more handsome of the two of you. So you guys can duke it out after the training and figure that out between the two of you. I'm not getting in the middle. So I saw Vondre put a very vulnerable comment in the chat that she didn't realize or think about sign language as being bilingual. So that's a really big learning piece, that ASL is a completely different language, and it has its own grammar, it has its own syntax. So I think that is a really big thing to bring home from today. So that working with somebody who is deaf, it's not just about presenting the information in a visual way, it's bridging languages and bridging cultures. What else came up for you all today as you were thinking and learning? Ron made a really good point about working with folks who have different levels of language. And sometimes the frozen text that's used in 12-step meetings assumes things. Like if somebody signed higher power, so that interpreter signed it a couple different ways. But what does that mean? Like HP, do you mean my computer? There's so many different ways that could be misinterpreted, not because the interpreter is not good, but because it's the responsibility of us as the provider to think about how do we make that concept clear. So I think sometimes as hearing people, we think, okay, well, that interpreter, they're just going to take care of it for us. But it's still our responsibility as providers to make sure that that information is conveyed clearly. And to check in to see what they're thinking and processing. For those of you who've worked with folks who are deaf and sign language users in recovery, what barriers came up for you? What challenges have you had? We are a quiet group today.
Yeah, come on, I'm curious too. What has your experience been thus far? What's been your takeaways from those moments, or the things that have stuck with you, be it a story or what have you? Because I mean, those moments can be powerful and be a learning moment that will benefit us, here forward.
Maybe we can think about it a different way. Makoto shared some different visuals. And I'm wondering, do you think those visuals could also be helpful for the hearing people you work with? I'm thinking about the literacy level for folks we work with in Kentucky. Sometimes people may not have strong English skills. What we found in a recovery mall in Hazard, Kentucky, was that when that center put up information in more visual ways, the hearing people benefited too. So it didn't have to make the deaf folks feel singled out because everybody was using those visuals and it helped everybody. because we all have different learning styles. Some people might be more visual, whether or not they can hear. So the more flexible we are with our techniques, the more it could benefit other folks. We have one session left with Makoto. So I'm curious for you all, what do you want to make sure we cover then in that last session? What do you want to make sure you learn about before we're done with this series?
Dylan? Do you have anything? I'm sorry, I thought you were
Sure.
speaking.
On mute, Dylan. You're talking to us. Nope. So he's saying so far they've not encountered very many deaf or hard of hearing participants in recovery, but they've been conscious of trying to do small changes in their day-to-day operations to be ready. So with our recovery community centers, what we're trying to do is make sure you have those video phones ready. Make sure you have your language access in contracts in place so that when people show up, they are ready and you're ready for them. Because if somebody shows up and nobody knows what to do, they may not come back. Ron?
Oh, I don't know.
I'm glad Dylan brought that up.
Right.
Because it does take time and patience to get that system in place and to have those resources ready to go.
Right.
And honestly, that word of mouth is huge. So, if you build that and then people start hearing about it out in the community, that, you've got interpreting access, that you have meetings that are interpreted, then that's when folks will come. But it does take time.
This is Michelle. So an example, Four Rivers made a video and they have an adult peer support specialist who is a CODA, a child of deaf adults. And they had him make a video so people could see him signing. They added voice and captioning. And he even said, if you don't like my signing, we'll make sure we get you an interpreter so that people knew that they had choices. And they project that video on their website and in all of their offices across their system. So first you establish the language access and train the staff, and then you start promoting it. And if you make really cool promos, Anthony and I are happy to share it across our system and to share it with the deaf community, because they're probably not just going to know what an RCC is. They're not just going to know what a community mental health center is. So we can also advertise through the trusted deaf-run organizations to get the word out, like what Makoto was saying.
Is it okay to talk?
Absolutely. Go, Vondre.
Okay, so I know this might sound a little crazy or whatever, but is there like maybe an app that maybe already is designed or could be designed to where if you spoke into your phone, no matter what language it was, like say if they were, just whatever other language than English, you would tap that, you would speak into it, but then it would have somebody signing what you were trying to say so that you could just show them, and that would be a way to interact with somebody if you weren't that intellect with sign language. Like, is that even a thing or?
So it's a great question, and everybody kind of wants the quick tech solution, right? There are apps in development, but none of them are going to replace having a qualified or skilled interpreter who understands what's happening. So for the quick needs, like if somebody walked into your office and you're like, oh crap, what do I do? That's when you can use those Sorensen video remote interpreting, or you can see if the other local agencies that you serve, that you are contracted with, if they have video remote interpreting. So it looked kind of like what we have here, where an interpreter pops up on screen to help you. The concepts on those apps are not usually clear. So you can use it for a short term, but you have to be really, really cautious to make sure that you know what's happening there.
Right. Well, I was kind of meaning not like like if somebody was coming to the office or whatever, but if you were just out and about
Mhm.
and say you're still learning or whatever, or just don't know, like me, I don't know anything about sign language whatsoever. And I know that there was 2 people that came down to the shelter that needed sign language and things like that. And they had came in and I felt so bad because I didn't know what to do and everything, but somebody else that was here knew how to help them and they were telling them what I was saying and everything. But it's just kind of like just being out and about. If there was just a quick thing, which I guess I should do my research and see if there was something like that before I go ask questions.
This is Michelle. I mean, there's lots of different things that could work. It's very individualized. So I think the biggest factor is you're trying and you have the right attitude. So for some people, it would work if you used a talk to text and it was a simple conversation. So you spoke into your phone and then showed them the text of what you're saying. Anthony and Ron, I'm curious about your perspective. What do you think our outreach folks should do? Ron and then Anthony? If you encounter somebody who's deaf for the first time and you don't sign, how can you help make them feel at ease and connect with them?
Okay, well, I remember when I was inpatient at rehab, I was more concerned about, interpreting and then getting services. I typically, when I am in something like that, I try to have a few interpreters that I know locally, that I feel comfortable with, that I have a rapport and feel like they will be mindful of my need for confidentiality. And so that person when I was asking, was able to sign yes and then no, just, a couple basic signs. But yeah, even trying just to, get that across, because without that access, it's frustrating and it's demoralizing. So being able, just to throw out those different names, to get that interpreting service established, just to make sure that I felt comfortable, and going forward with treatment and disclosing some things that felt more personal. But yeah.
This is Michelle. So one idea for your outreach teams would be to have a card that has your contact info on one side and says on the card that LRCC or whichever RCC or agency you're with will get you an interpreter. So to give a card to let people know that if they come to your services, you will make sure they have language access. Anthony, do you have
And then
Anthony, do you have ideas? And then Ron, you can add more.
yeah, would you mind to repeat the question?
Like in Bondre's example, she went out and she met somebody who was deaf and she doesn't sign. And she felt awkward because she wanted to connect with them. So what are suggestions you have for hearing people who don't sign, but want to connect with someone who's deaf until they can get an interpreter, until they can get access?
Well, I mean, I think, the first thing, if you meet somebody who's deaf, bring out that pen and paper. And then if you've got your phone handy, being able to utilize that as an option, even just gesturing. If you've got a few little signs in there, just basic, gestural communication. Because I find that most deaf folks are going to be pretty patient with people who don't know how to sign. Goes back to that flexibility piece and just figure out what works in that environment and what needs that they have and how to go from there. It's just a learning process.
This is Michelle. Thanks, Anthony. Ron, did you have anything you wanted to add there?
Yeah,
Thinking about the LRCC, or really anywhere. If you've got a list handy of interpreting services or places that you are already aware of, and that way you can go through that and see who's available right away.
don't know how to sign.
And then, you may have some deaf folks who really don't sign much themselves. They may not use American Sign Language, and that kind of goes back to like the pictures like Makoto had used, bringing out those visual aids.
Anthony, and then we're going to need to wrap up.
Well, when Ron was just talking about, having that list of interpreters handy. Yeah, I mean, having those options and like, a few of them, it's going to be beneficial because you may try to reach out to that one and they may not have anybody available. So having some of those contingency plans in place, but just having options to resolve whatever happens in that moment.
This is great discussion. And we are at the end of our time. I feel like this has been a very beneficial session. Makoto, do you have any last words of wisdom that you'd like to share with folks?
I mean, words of wisdom, not so much, but just want to express my gratitude for everyone who's here today and coming in with open heart and mind and jumping into something scary and being willing to engage with us. And having that flexibility, and being willing to think creatively and outside the box. I appreciate it. And being able, to work collaboratively. That way, when you do have something that you don't know the answer to, you've got plenty of resources and points of contact that you can reach out to brainstorm together. So thank you for coming today. I'm looking forward to working with everyone again as we think creatively and we, compile some ideas that we can use going forward. So I look forward to that in part 3.
This is Michelle. Thank you so much, Makoto. I know you worked hard to make the PowerPoint accessible and to make sure that we all could benefit from the session today. I am putting the link to the evaluation in the chat. Please make sure you complete that evaluation so that we can send you your CEU certificates. I actually emailed last time's certificate during today's session, so you should have that waiting in your email box. And if you have anything that you would like to make sure we cover in our last session, please email me and I'll make sure Makoto knows that. I want to give huge thanks today to Alicia and Heather, who showed grace and flexibility. Alicia had to drive from Georgetown to Lexington because her computer wasn't working. And she just popped on there like nothing had happened. So we really appreciate that. And thank you to Tracy, who is our CART reporter today. She's always there in the background, making sure we have a great transcript. So thank you all for making this a great session, and I hope you have a really nice weekend.